Hello and welcome to today's session on supporting children with autism in in-home care. Before we begin, I'd like to thank you for attending and acknowledge the traditional custodians of the lands on which we all meet on, and pay my respects to elders past, present and emerging, and to all Aboriginal people present. Our outcomes for this session will be... Wendy, can we start again? It's not clicking over. Hello and welcome to today's session on supporting children with autism in in-home care. Before we begin, I'd like to thank you for attending and acknowledge the traditional custodians of the lands on which we all meet on, and pay my respects to elders past, present and emerging, and to all Aboriginal people present. Our outcomes for this session will be to explore what is autism, strengths, family-centered practice, expressive and receptive communication, characteristics, play and social interaction, restricted and repetitive patterns, sensory processing, and behaviour. So what is autism? Aspect, or Autism Spectrum Australia, describes autism as a condition that affects how a person thinks, feels, interacts with others, and experiences their environment. It is a lifelong disability that starts when a person is born and stays with them into old age. Every person with autism is different to every other. This is why autism is described as a spectrum disorder. Aspect describes autism as a different brilliant. This is the perfect description of autism, and recognizing that unique brilliance will support relationships, your programming, and your joy as an educator. In children's services, we tend to use the term child with autism rather than autistic child. This is to ensure our language communicates that the child is separate from their diagnosis. Children with autism can display a wide range of characteristics in their strengths, communication, and social interactions and play. Looking at strengths. Areas of strengths and interests vary among individuals and include logical thinking, visual thinking, persistence, an eye for detail, memory for facts and figures, technology skills, deep interest in typical topics, and very strong focus on specific interest. And some people with autism may have exceptional ability in one or more areas, such as music or mathematics. People with autism tend to have an ability to notice specific details, patterns, or changes that others may be unaware of. And for around 20% of people with autism, there will be an exceptional or above average ability in one or more specific areas. But as with everyone, strengths are always unique. Supporting the child. Children with a diagnosis of autism may be attending different therapy services. They may be experiencing challenges in making friends, and as the educator, you are one of the most consistent people in the child's life. The value of the role to the child and family cannot be underestimated. Your role is to provide the child with stability through routines and expectations, support by working with therapists and families to include therapy focuses in play, support other children in understanding how to play inclusively, and offer opportunities to continue to develop important life skills through play. In a nutshell, knowing how the child is to be supported with communication, social engagement, play, and sensory processing. Know what interventions you should include in play-based learning. Include the family. Support the child in accessing the community in an inclusive way. Clear communication around routines. Use alternative communication supports, such as visuals or keyword sign. Family-centered practice. When you are working with a child who has autism, you are involved in early childhood intervention. The rights and needs of families to make decisions for their child and for their own lives has been widely acknowledged, and in family-centered practice, parents are regarded as the experts regarding their child and family, and are encouraged to determine priorities for intervention. As an early childhood professional, you would be familiar with developing professional relationships and working in partnerships with families. Relationships are a key to the success of all children's services programs. Close relationships are respectful of each individual's values and beliefs, as well as past experiences. Within the context of early intervention, as with all children's services, being respectful of families involves respect cultural differences, acknowledgement of families as having the most knowledge about their child, appreciation of the family's right to determine their level of involvement, ensuring confidentiality, supporting the family, ensuring ongoing open and clear communication. Exploring now the impact on families. An awareness of how a family is impacted when a child has autism can be helpful to the educator. Knowing the types of challenges they will face will support you in building a strong relationship where you can empathize, respect, support, and collaborate with the family. Each child and family is different, so don't assume to know how one family will respond based upon your experience with another. Take the time to build mutual trust and respect so there can be sharing of information between you and them. Strategies for the child's family. Form a relationship and build trust. Develop open communication. Respect the family as the child's expert. Empathize with their personal stress. Find out their goals. Ask how they answer questions about their child. Developing a relationship with the family will support the development of relationship with the child. Clear communication approaches, showing an interest in the child, are all key to this. Through these relationship practices, you're also modeling positive relationship and communication approaches to the child. Expressive communication. Barriers to expressive communication can be in the unpredictable nature of conversations. Children can sometimes gain a sense of control over this by expressing themselves using echolalia, which is repeating phrases from people, TV shows, or songs. Using visuals, being pictures to support communication, can assist in supporting that predictability. Visuals are a series of pictures that communicate regularly used phrases or routines that are frequently used or choices of activity. When a child with autism is overwhelmed, they may express this by yelling or through tantrums. Common things that may overwhelm them are sensory stimulations, or such as loud noises, like the neighbor's lawnmower being used. A change in their routine, such as the school holidays, brings about a change in their regular routine, or rain might mean outdoor play is needing to be rescheduled. A change within their daily schedule. And this might look like transitioning from play to pack away time. During these times, educators need to create a sense of calm and predictability. Forewarning and plenty of communication around routines and next steps is so important. Continuing on with expressive communication. There are so many different ways to communicate. Take some time to observe the child and recognize what they are saying. Identify where they are giving you permission to be involved. For a child that is nonverbal, who engages in solitary play, you might begin by playing alongside them, copying their play, and adding language. Label your actions in play, and this might look like, I'm building with the red block. I put the blue block up. Oh, crash, or fall down. This engagement supports the child in developing relationships, language, and play skills. So through this communication, you're labeling actions which may support the child in taking an interest in your play. I once had the pleasure of educating a young boy who had a great interest in jingles from television shows. By learning the jingles and singing along with him, we were able to form a basis of a relationship. We then used the jingles to establish relationships with other children through playing with the volume and changing the tone of my voice to be comical. And over time, relationships with other children were formed. We then used the jingles to support the development of relationships with other adults by changing the words of the songs to include their names. To this child, jingles were an essential means of communication, and my role as the educator was to use the jingles to support any barriers to relationships that he may have had. This child always knew he could come to me to sing his jingles, which provided him a sense of stability. And now we look at receptive communication. Tips for expressing yourself to effectively communicate. Use simple language. Avoid jokes or sarcasm. Place emphasis on keywords in your sentence. If you know any keyword sign, this can be a great resource. Keep instructions simple, one step at a time. Think about the different ways you can use your voice to project clarity. And use visuals to support your verbal communication. Visuals are a wonderful resource in supporting children who have autism. You can use them to communicate your routine, communicate what's happening next, break down specific routines such as toileting, communicate choices for the child. We've been speaking a lot about creating an environment which is calm and predictable, and visuals will support this. You may be lucky enough to find some ready-made visuals that fit your routine if you do a quick Google search. So what are the characteristics of autism? For a diagnosis of autism, a child would display characteristics in these three areas: difficulties in social interaction and communication, restricted and repetitive interest in behaviours, and sensory processing challenges, with indicators evident in categories of behaviour, play, social skills, communication, and sensory processing. Looking now at play and social interaction. Play is often a social experience with a lot of verbal communication. For the child who is developing their receptive language skills, this can be overwhelming. When I was educating the young boy I spoke about earlier, I set up a social experience of baby baths, dolls, water, and washcloths. I had intended and assumed that the children would know that this experience was for them to wash the baby dolls. But for my young friend, he put himself in the bath and started to wash himself. I realized then that I had not communicated how this play was to be played. The next day, I set up the same experience, but I added visuals. step-by-step pictures of how to wash the baby dolls. The little boy understood how to play and was able to interact alongside the other children in a positive way. I think this highlights the importance that we shouldn't assume that a child will know how to play with a planned experience. Take some time to communicate what's happening and how they should engage. Social communication and social interactions. Children with autism may experience discomfort in busy, complex social situations. People with autism can sometimes be misunderstood in social interactions, as they may communicate honestly and directly, dislike or have difficulty with sarcasm, small talk, or jokes. Repeat words or phrases seemingly out of context. It might take some extra time to understand spoken information. They may be delayed in learning to understand and regulate their emotions. These can be barriers to forming genuine friendships. Educators can support this by educating other children in the social setting to understand the intentions of communication strategies and support all children in playing inclusively. Children with autism tend to pay attention without making eye contact, use or respond to body language differently. They may use sounds, signs, gestures, or pictures to communicate instead of spoken words. They may not use or understand gestures, like pointing. They may have difficulty understanding how others think in some situations. Children with autism may prefer to play alone or next to others more than with them. They can develop a strong and sometimes overwhelming emotional connection to others. And they can be comfortable socializing through technology. We look now at restricted and repetitive patterns of behavior, interests, and activities. Children with autism may use repeating movements such as hand flapping or pacing around to show excitement or to help them cope with stress. They may prefer to do things in the same way. They may engage in non-traditional play, such as repetitive lining up of toys. They may have a preference for leisure play based upon their passions. These behaviors bring a sense of comfort, control, and predictable routine. If these behaviors are preventing the child from developing skills in other areas, you will need to look at all of the supports we have spoken about previously. Family input, early intervention strategies, communication, tools, social interactions. Developing all of these skills will support the child's behaviors. Children with autism have an ability to focus on one thing for a very long time and have difficulty switching from one thing to another. They can have uneven pattern of thinking abilities. You may notice a child who is playing with trains for hours on end, and yes, they might have a great interest in trains, but what this actually highlights is that the child needs support with transitioning from one task to another. And you can use timers to support this, but forewarning and communication is vital here. You might use language such as, we will play trains until 10 o'clock. First trains, and then morning tea. Trains for 10 more minutes. The timer says trains are now finished. Now is morning tea. Taking these steps shows that you've prepared that play environment. You've communicated your intentions with the child and used simple language. And so the takeaway point here is that the role of the educator is to support the child's interest and use this to foster other skills. We definitely want to avoid a situation where we're denying the child the use of their play focus or not continuing to build those important life skills through play. Let's take a look now at sensory processing. Sensory processing involves the ability to organize and interpret information received through the senses: sight, hearing, touch, taste, smell, and movement. Children with autism may be constantly aware or more aware of some sensations: sounds, smells, taste, or touch. They may become distressed or overwhelmed if there are too many sensations at once. They may avoid distress by covering their ears or hiding in places to block sensations. They may experience discomfort with touch, such as clothing, material, or tags, or touch from others. They may seek sensory experiences by smelling food or flicking their fingers in front of lights, patting or touching other people. They may not notice internal sensations like hunger or pain or the need to use the bathroom. Every individual has a unique sensory profile. Sensory processing varies from person to person and in different environments, and any strategies needed to be tailored to the individual needs of the challenges of that child. When including a child with hypersensitivity to noise, for example, we need to be aware of and manage the noise or sounds that trigger reaction from the child. I recently saw an image that explained sensory processing with a focus on food. The image had 4 blueberries, which were all described in different ways. One was squishy, one was soft, sour, and one was sweet. There were also 4 crackers, and each of these were described as all being the same. For some children with autism, they can gain reassurance with predictability from processed foods. This brings us back to the importance of consistency and routine for children with autism. And for some children, finding foods that will provide this consistency is important. Being in environments that are unpredictable with crowds or loud noises may be overwhelming. As an educator entering the home of a child who experiences autism, be mindful of potential sensory triggers, such as perfumes or noisy jewelry like beads or charm bracelets or watches with alarms. Behavior. The important thing to note here is that all behavior is communication. When we're looking at behavior, we are looking at what purpose does the behavior serve? What is the child trying to communicate? Observe. What happens before the behavior? What might be the trigger? What behavior are you displaying that may impact the child's settling? If you find yourself in a situation where a child has expressed themselves through meltdown, flapping, squealing after an event, take some time for yourself and ensure that you complete reflections. Ask yourself these questions. How can you support the child to develop skills in using alternative means of communication? Does the child need support in using a non-verbal means of communication, such as visuals? Has the child experienced a change in their routine? What support does the child need? How can this support be supported in the future? Behavioral expressions can occur when the child is not in control or does not have an awareness of what is happening around them. These behaviors can sometimes be avoided by creating a calm, predictable environment will be the greatest support to the behavior. And this could be achieved by supporting the sensory needs of the child, having clarity and communication around routines and expectations, ensuring the environment is set for play. If the child has a regular truck that they use for play, make sure that they know where to find it. When looking at behaviour, it is important that we encourage positive behaviour by developing a predictable environment, using positive reinforcement of appropriate behaviours, and teaching new skills. You may find that even when you are doing your best to create a calm, predictable environment, challenging behaviour still occurs. And when that happens, regain the calm. Children will have something that brings them calm. It could be water play, music, outdoor play. This will be quite unique to the child. Listen to the child. Has something triggered this behaviour? Communicate with the child's family and allied health workers. Some children may have some sensory aids that can support them during these times. Things like chew toys, swings, tight cubby nooks, or weighted blankets. You may be able to connect as I'm speaking that certain aspects will be within scope of the educator to provide. Making a cubby nook or going on a swing. If these are supportive to the child, go ahead and have fun with these things. But not all sensory experiences support all children, and some sensory aids will need the input of professionals. So speak to the parents about what they use to support their child. As an educator, you will need to develop strategies for working with others, as well as occupational therapy. Other professionals may be involved with a child with autism, including speech therapy, medical practitioner, autism-specific educator, as well as the family members. Clear and up-to-date information needs to be shared among all involved, and the following may help. Thorough written information on the child and family's needs, strengths, and goals. Learn about autism and the child's particular needs. Communication book for families, educators, and other professionals. Work with professionals. Share information and your knowledge about the child. Implement strategies suggested by therapists. Record child's progress, success, and failures with strategies and changes. Respect each other's professionalism and knowledge. I hope that our webinar today has provided you with some useful tools to apply in your educating experiences. If you'd like to continue your research, the AASS, Autism Awareness and Aspect are fabulous resources. I'd like to thank you for taking the time to view this webinar and wish you all the best in your practice as educators.